what we will speak about for the next few minutes is the best diet for the heart. Is it only about the foods you eat and other things? My disclosures are here. As Dr. Taylor mentioned, this book, Live Younger Longer, is all about prevention of chronic diseases. And I'll really no conflicts today with anything. I'll stay that with peer-reviewed research. The learning objectives will be to appreciate the importance of diet in the development of heart disease, review the dietary components that may increase or decrease the risk of cardiovascular events, and then finally learn what diets are linked to coronary artery disease regression. Now, as many of you may know, there are multiple risk factors for chronic diseases. These happen to be the risk factors for heart disease and also for non-communicable diseases. About 20 years ago, more people started dying in this world of non-communicable diseases than communicable diseases, of which heart disease is one of them. Others are Alzheimer's and cancer and diabetes. But while there are 6 or 7 major risk factors that I remember just with the use of a compass: nutrition, exercise, stress, sleep, smoking, and spirits, and then weight, the recent studies have shown that diet has now become the number one risk for early disease and early death for heart disease and non-communicable disease in the United States and really in the world. And part of that is because they are counting it differently as things that lead to hypertension because of the salt intake or things that lead to heart disease. But clearly it's got a much more prominent role. Now, one question is, how are we doing in the United States with regards to our diet? And the USDA has come out with 5 components for a healthy diet: eating at least 4.5 fruits and vegetables a day, servings, having fish 2 or 3 times a week, having a rich fiber in your diet, at least 3 a day of grains or fruits or vegetables, having less than 1,500 milligrams of sodium a day, and then sugar-sweet drinks, less than 450 calories per week. So how are we doing in our country in that regards? If you look at the population consuming 5 of these 5 in terms of healthy side of it, for adults over age 20 years old, about 1 in every 300 adults is eating a healthy diet. With children age 12 to 19, it's much less. Only about 1 out of a few 500 or so are eating a healthy diet. And the predominant part of the children's is the sugar-sweetened beverages that they're consuming highly. So if our population's not doing well with diet, how are we doing in the medical profession about educating ourselves about nutrition? Well, if you look at medical school, as Alan implied, it's the medical school curriculum's declined on average in this country to about 19 hours, which is about 0.2% of the time we spend in medical school. If you then look at internal medicine and family medicine residency, 26% of programs offer training, while less than 1 in 5 trainees say they're confident in their ability to counsel patients about diet. And then finally, cardiology, and we get a lot of this, unfortunately, the end result of poor diet with heart attacks, heart failure, hypertension, etc. But in a recent poll, 90% of over 600 practicing cardiologists reported they had no or minimal nutritional training during fellowship. So first, our patients and our population are not doing well with eating, and we're not doing very well with educating ourselves to help them know how to eat. So what is the best thing to eat? What if you look at foods that decrease or increase mortality? So I'm going to show you a couple of slides. And this is first a slide of foods that decrease mortality. And just to orient you, the red line is 1. So anything below the red line, mortality goes down. If it's above the red line, like on the next slide, mortality will go up. And the green dotted line is the 1 serving. So this would be 1 serving of whole grains, which is 1 ounce. Vegetables, fish, fruits, legumes, and nuts. All of these will reduce mortality. And you can see 1 serving, and this is over many years, obviously. And but even 1 serving will make a difference eaten on a daily or weekly basis. Now, what about foods that increase mortality? Well, red meat will increase mortality. You can see this is above the red line. One serving a day over many years will increase it about 15%. Processed meat is even worse in that it will increase it with smaller amounts uh, significantly. And processed foods, as we'll talk about, are similar, as evidenced here in sugar sweetened beverages. That one serving of a sugar sweetened beverage, which would be about 8.5 ounces a day, will increase mortality significantly. Now, what about foods that do a little bit of good at low doses, but at higher doses are troublesome? Well, refined grains are that way. You can see that mortality may go down a little bit, but after we start to eat more than a few servings, you start to have increased mortality. Eggs, maybe a couple of eggs a week is okay, but this is one serving of eggs that will increase it. And then dairy, small amounts, again, not bad, but as we start to eat more and more and more, and of course, in our society, the problem is all the volume of foods that we eat. So a small amount of refined grains and eggs and dairy are okay, but large amounts get you into trouble. And by that I mean, if you look at the serving size, the refined grains or whole grains, I've had patients tell me, I eat whole grains, I'm gaining weight. Well, I ask them to explain what they're eating, and they're eating 20 servings of whole grains a day, because they don't realize that 1 ounce of grains is a serving. Fruits, vegetables, nuts, legumes, all these things are very healthy. And then even the small amounts, a deck of cards of processed meat or 8.5 ounces of sugar sweetened beverages can start to get us into trouble. And these last two are the ultra processed food category. And ultra processed foods I want to talk about for a few minutes. It's important that we understand what they are and what they do to us, and how much of them we're eating. Well, what is an ultra processed food? It's, there's many definitions. I think this is as good as any. It's industrial manufactured, ready to eat or ready to heat formulations made mostly from substances that are derived from foods with little, if any, whole food in it. So we all know what these things are. We've all seen them. They're chips and cookies and lots of different checkout line foods at the convenience store that we pick up a couple of them as we're walking out the door. But to be more specific, think of foods in 4 groups. Everything has to be processed to some degree. You take, green beans and clean them and freeze them and put them in a bag. That's processed, but it's minimally processed. So that's level 1. Level 2 would be processed culinary ingredients like oats or pasta. You have to cook, but it's still processed. Then the 3rd and 4th would be the processed foods. That'd be first, the whole foods preserved, usually with salt, with sugar, oil, other methods that such as smoking it or curing it. An example would be jerky, for instance. And then the ultra processed is the worst level in terms of what it does to us. It's essentially these industrial formulations, mostly or entirely made from industrial ingredients. Again, chips, cookies, cola, open and eat things. And of course, we know that we shouldn't eat these things. So what does it do to us if we do eat them? If you look at a recent study of ultra-processed food intake, and this is just over 2 weeks, that they gave subjects in the study either ultra-processed diet or unprocessed, and you can see the calories they ate. They could eat whatever they wanted in calories, that is, and look at their body weight. And over just 2 weeks, you can see that the difference in body weight was a couple of kilograms, so maybe almost 5 pounds. Multiple reasons. One, we eat more of them, ultra-processed foods. And secondly, they have things in them called EDCs, endocrine disrupting compounds, that actually affect our metabolic rate, that lower it, so we retain more weight. And other things called obesogens that actually, again, affect our endocrinologic system to increase our weight. So there are many things in them that work against us. And it's interesting, in Europe, these obesogens and EDCs are not allowed. But in our country, unfortunately, they are allowed to be in the foods. So how much ultra-processed food are we eating? Well, if you look at a recent study of the total calories, this is just before the pandemic, the total calories, the percent from ultra-processed foods in the U.S. And you can see this is the quartiles on the bottom, and on the y-axis is the percent of calorie intake. The lowest quartile was about 25%. The highest up to 85% of calories, and the mean is 56% of the calories consumed in this country every day are ultra-processed foods. And of interest, the younger you are, as you can see age, the more likely you are to eat ultra-processed foods. Unfortunate but true. Our youth are not really doing the best with their diet. And it's of interest too that with the 2022 update, that about the average has gone from 56% during the pandemic up to 60% of the calories. And now the young adults aged 18 to 35, about 2/3 of their calories total per day are ultra processed foods. Now, what do they do to us? We eat a lot of them, but what do they do to us? If you look at the effect of ultra processed foods on mortality, and again, very recent data, that consuming at least 4 servings of ultra-processed foods a day will increase all-cause mortality 62%. This was about 20,000 patients followed up for 15 years. And eating an additional serving of ultra-processed food, 1 serving will increase your mortality 18% over these 15-year period. Now, what are the top ultra-processed foods we eat? Well, there are things like pastries and cookies. I remember these because of the cookies, the Oreo cookie. There are 3 things about it that I think that help me remember. One is that they're loaded with extra fat. 2, they're loaded with extra sugar. And number 3, I love them. I love to eat Oreo cookies, but they're the most popular cookie, unfortunately, in the United States. Processed meats. These are sausages, hot dogs, things like that. Sugar sweetened beverages we've mentioned. Dairy products, especially the higher fat, the ones that have additional sugar in them, and then French fries. And this makes up about 70% of the calories consumed from ultra-processed foods. So as I pointed out, consuming at least 4 servings a day will increase your mortality 62%. Well, how many servings of ultra-processed food does the average American eat? Well, it's a very recent study looking at the Framingham offspring, which is, an unselected cohort of people that are the offspring of the original Framingham cohort, show that 7.5 servings of ultra-processed food is the average in that cohort eaten per day. And other studies have shown pretty much the same thing. So it's about 52 servings per week of ultra-processed food. Now, if we eat so much of them and they're not good for us, why are we eating so much of them? Well, of interest. So we're talking about why, if we eat so much of them and they're not good for us, why are we eating so much? Well, or could they be addictive? And the Yale School of Medicine actually has a very extensive research on ultra-processed foods, and they categorize them just like you'd categorize anything that you may have an addiction with. Do you try to quit and you can't quit? And you're embarrassed, or do you try to go out of your way throughout the day to get access to these things? Do you try to hide them from your spouse because they're bad for you? And the most addictive foods they found, things like on the left, pizza, chocolate, chips, cookies, etc. The least addictive on the right, which the least addictive food is cucumbers, which is very interesting. But addictive is processed, high fat, high glycemic load is what they found. And if you look at the foods on the left, this reads like a teenager's diet, pizza, chips, cookies, ice cream, French fries, cheeseburgers, and regular soda. Other things of interest is you can take a food that's not highly addictive, like corn, put butter and salt on it, and it becomes more addictive. So we are really getting addicted to some of these foods, and it's a fascinating concept. The other thing we've talked about is our youth. And I point out a couple of things that our youth do. And what about kids in school? What are we teaching our kids about ultra-processed foods? If you look at a recent study of school-provided meals, ultra-processed foods make up about 64% of the calories. So people say, oh my gosh, why can't kids bring their lunch to school? Well, 53% of children do bring their lunch to school, and they've actually found there's more ultra-processed food calories in a homemade lunch than there is in a school-provided lunch. Apparently, moms and dads were all so busy, we just throw in the bag whatever we can. So children eating ultra-processed foods have an increased risk of being overweight and being obese. And then ultra-processed foods, as we talked earlier, are linked to obesity, diabetes, cancer, heart disease, and early mortality. There are other diets that are out there that have actually capitalized on the ultra-processed food problem. One of them is the paleo diet. Many of you have probably run into patients that talk about being on the paleo diet. And paleo discourages processed cereals and grains, dairy, legumes, and culinary ingredients like oats and pasta. And they discourage ultra-processed foods. But they promote fruits, vegetables, nuts, eggs, meat, and fish. And patients really love it because they can eat all the meat and the eggs and that they want. But if you look at the data of what happens with patients on a paleo diet and cardiovascular events, which was cardiovascular death, acute MI, and stroke, that quartile 5, meaning the highest level of the paleo diet versus the lowest level, the hazard ratio for these events was 0.45. So it reduced it significantly over 12 years. And you say, wow, this is really surprising to me. But if you look at the data and what part of it, and this has been analyzed, what part of the paleo diet is really hurts you or helps you, and you remove the ultra-processed foods from the paleo diet, and there is no mortality or no event benefit. So that's of interest. It's basically the ultra-processed foods that they limit that helps them. The second thing is all the benefit in the study was found to be due mainly to the fruits and the vegetables, which are highly promoted in the Mediterranean diet. So what is the Mediterranean diet? Well, there's been a specific one that's been in the Preventive studies that we support and we actually hand out to patients here. That's everything above the red line you can eat more of, below the red line eat less of. Extra virgin olive oil, very helpful. Nuts, very helpful. Obviously, unprocessed foods, you get 3 servings a week. A little bit of dairy, a little bit of meat, and then some legumes and white meat, poultry. The reason cola is here is that any cola, whether it's diet or regular, has phosphoric acid in it as the third ingredient, and the phosphoric acid has been shown to damage endothelium. So small amounts, again, are allowed, but not large amounts. Now, the Preventive study, I'm sure you've heard about this and seen this data, but this is the revised curves for outcomes that came out about 4 years ago, that it showed there was a reduction in heart attack, stroke, and cardiovascular death. But of interest, a couple of things. One is the Mediterranean diet either got extra virgin olive oil in the green here, or extra nuts versus the control diet. And the control diet was what I would call the SAD or SAD diet, which was the standard American diet. Second thing of interest is that the event curves diverged very early in the first few months. And the third is that about 3 years into it, they realized that they were talking to the Mediterranean diet group every quarter and reminding them how to eat Mediterranean, but they weren't meeting with the control diet group and reminding them how to eat the control diet. And so they started doing that, and you actually found the event curves diverged even further right after 3 years when they met with them. So the diet really has been shown to be very helpful, and the greater you adhere to it, the greater the reduction in events. And what are the events that are reduced? You can see here, not just a death from CV disease and stroke. It was primarily driven by stroke in this study, but death from cancers have been shown as sub-studies of a priori endpoints in this Preventive study. It reduces Alzheimer's, reduces atrial fibrillation, which is of great interest, I think, reduces arthritic pain. It's a very anti-inflammatory diet. Reduces diabetes, erectile dysfunction, the only diet I've seen that reduces female sexual dysfunction, and reduces macular degeneration and Parkinson's disease. And so really, if you look at the data, the only 2 diets that have been shown prospectively to reduce cardiovascular morbidity and mortality are Mediterranean and DASH, the dietary approaches to stop hypertension. And DASH is basically a Mediterranean with lower salt in it. So a quick case to demonstrate a point. You are discussing healthy nutrition patterns with a 65-year-old man. He asks you what the benefit of extra virgin olive oil is over other oils such as corn, canola, and soybean. And so the major benefit in cardiovascular risk reduction from olive oil is its A, high monounsaturated fat level, B, high anti-inflammatory properties, C, reduction in LDL, D, increase in HDL, or E, reduction in blood pressure. And as you're thinking about it, the answer I would propose would be that it has high anti-inflammatory properties from the EVOO. And if you look at these other oils, they're all very highly processed, the corn, canola, and soybean. So they lose their anti-inflammatory properties as compared looking at studies that look at reduction in HSCRP or interleukin-6 and other inflammatory markers. And extra virgin olive oil helps lower those inflammatory markers. Plus, if you process it highly, it will lose the ability to be anti-inflammatory. And this study of the women's health study, they looked at 30,000 women and said, what of the Mediterranean diet score, the ones that ate more Mediterranean diet, what was the benefit from? And about 30% of the benefit was from its anti-inflammatory component. Other things are helpful too, obviously, but this just demonstrates the benefit of being on a Mediterranean diet, reduces inflammation. Now, I've talked to my children. I have 3 millennial children, and I've talked to them about eating Mediterranean. They say, why do we need to eat Mediterranean, Dad? We're healthy. We don't need to worry about all these things right now. And I said, well, you know that if you eat a Mediterranean diet versus a Western diet, it's better for the environment. And they said, well, what do you mean? I said, well, switching to Mediterranean, you reduce your greenhouse emissions by 70% or more, reduce land use, reduce energy consumption, reduce water consumption. And they said, oh my gosh, we didn't know this. We'll start eating more Mediterranean. So it's great that this younger generation is very focused on the environment, which is wonderful. One of our founders, Charles Mayo, the younger Mayo brother, had a great quote that I think is very germane today. He said, it is unfortunate that people do not understand from what small things diseases come. And by that, I mean, in this case, obviously our diet, that even small amounts of dietary change can benefit you. So a few years ago, a study was put forward showing that if you replaced 3% of red meat protein with plant protein, there's lots of protein in plants, obviously, that if you replaced the processed meat or unprocessed red meat, the most benefit was if you replaced the processed red meat protein. That would lower the event rates, all-cause mortality, by 34%. And the benefit is greater if you have more risks, like if you're a smoker, if you have heavy alcohol intake, overweight, or you're physically inactive. And so even small changes can yield big results, because 3% is a very small amount of calories. Maybe if you're eating a 2,000 calorie diet, that would be 60 calories or so. So it isn't a whole lot. The other thing is, if you look at the disease we're all most fearful of, it's not heart disease, but it's usually cancer, or in this case, dementia. That ultra-processed food intake, just decreasing it or increasing it 10%, is associated with an increased risk of dementia. Decreasing it 10% will decrease your risk of dementia, as shown here. So the evidence is pretty clear that associating ultra-processed foods, not just with heart disease and death, but also depression and now dementia. And so as an example of what you could do differently, well, if you ate a ultra-processed food like a hot dog, 150 calories, that would be about a 10% of your daily diet, and especially if you put some ketchup on it, which about half the calories in ketchup is processed sugar. That'd make it up to 200 calories. So that'd be about 10% of your diet. And replacing that with something a little healthier to eat would certainly lower your risk of dementia. The others have proposed that we try to eat more vegan or vegetarian. This is from the Preventive study that showed that if you were the least compliant with the Preventive study in the treatment arm, the active intervention arm, versus the most compliant, you had a much higher reduction in total cardiovascular mortality. And they did this by just measuring the amount of meat, dairy, protein, and fish that you ate if you cut that down. But don't get fooled and think that all vegetarian or vegan diets are healthy. If you ate the way the Preventive instructed, it would be. But too many times we can eat a vegan or vegetarian diet that is not so healthy. And so here's a plant-based diet in Inhane's study, and they did surveys of how patients ate in terms of their healthful or plant-based dietary index or unhealthful plant-based dietary index. And these were primarily processed foods that were in here for the plant-based, because it was all plant-based diet. And you can see that the more they ate the healthy, the lower the mortality, either total mortality due to cardiovascular disease or due to cancer. And the more they ate the unhealthy food, the greater the event rates. So plant-based diets are not always healthy. You know, macaroni and cheese may taste great, but don't make too much of a habit of eating it. So we talk a lot about what we eat, but of course, as everyone knows, it's not just about what we eat. The other things like how much we eat, obviously a serving size, we're way over what we should be in this country. How we cook what we eat, you know, do you use olive oil? Do you not char it? Do you not burn it, which has carcinogens in it? Where we eat now, about a quarter of the meals eaten in this country are eaten in a car, and about almost half of our calories are eaten out, not cooked in our home. When we eat, the average American eats a considerable amount of calories within an hour of waking up and an hour of going to bed. And then what we're doing while we eat, meaning we're not really paying attention to what we do. We're eating fast, or we're watching TV and just gulping down. But I really think the single most important question to ask a patient is why. You know, why are you eating? Is it boredom? Is it fear? Is it anxiety? And help patients understand why they're eating, not just how much, but also what certain foods they're eating. And the ultra processed tend to come up frequently. Now, another quick case representation. You're seeing a 46-year-old woman today for coronary artery disease risk reduction. Her current diet could be improved. She asks what the optimal amount of carbs in her diet should be to reduce mortality. So the lowest mortality is seen with carbohydrates at what percentage of total calories? Is it 10 to 20 like the keto diets, or the 20 to 30 like the low carb diets, 30 to 40, 40 to 50, or 50 to 60? And of interest, it really is a higher carbohydrate diet that we've been eating on this earth for a long time and has been shown to have the lowest mortality, as seen here. Two studies, the ERIC study, the atherosclerosis risk in the community study, and the PURE study, which was done by Salim Yusuf out of McMaster in Canada, they looked at the carbohydrate intake as a percent of total calories and all-cause mortality. And they found that the lowest mortality is this U-shaped curve with carb intake on the x-axis and mortality on the y-axis. You can see that the ARIC and the PURE were a little different, but basically it's in this 50 to 60% range. And the 50, so that's about right for what we should be eating, but they must be unprocessed carbs, not the processed things. So if you look at the Tsimane Indians, who are an Indian tribe that live in the Bolivian Amazonian rainforest, and they've been termed by Lancet to have the healthiest hearts in the world, because a Tsimane Indian, a 80-year-old man, has the same amount of calcium in the coronaries as a 50-year-old American man. They eat 72% of their calories as carbohydrates, but they grow on plants, they grow on vines, trees, bushes, whatever, and they also walk 17 kilometers a day. They've actually taken CT scans down to the forest and done CT scans on their heart. So if you tell a low carb, keto person to eat 60% or 50% of their calories as carbs, they get excited, and that's not a good excitement either. So the USA is focused, though, on losing weight. That's our our kind of number one book genre almost is dietary books and how to lose weight. And if you look at we mentioned low carb. If you look at the low carb diet, which is high fat, that low carb diets, this is just the most recent of many studies that have shown this, that low carb diets increase all cause mortality if you eat the low carb with meat and processed meat as a lot of the fat that's in it. You can see here the fourth quartile was the lowest carbohydrate and the highest fat, and they had the highest all-cause mortality. They also had the highest cardiovascular mortality and the highest cancer mortality. And this is from a very large NHANES study. The low-carb diet has been out, as many of you may know, since the 1860s. It was brought out by a London undertaker to try to help reduce obesity. Well, and we've been focusing on the low-carb diet about every 10 or 20 years ever since. As you can see on this very busy slide, but I'll simplify it for you. This is the obesity rates and diet trends in the age 20 to 74 people. So it started back in the 60s up until now, and this is from our book. But you can see that in 1960, the obesity prevalence in the United States was about 13%, and it's increased since then up to now 43%, and probably going up more to 45% now in 2022. But there have been many diets. The Atkins diet was one of the earliest that I remember low-carb diets. The Pritikin diet, Scarsdale, Paleo diet we mentioned earlier. South Beach has a component of, and keto, certainly there's a high-fat, low-carb diet. And you can see that they're not working. Although any diet works if you stay on it. That's been shown in multiple studies, but we're just not staying on it. It's very hard to stay on a low carb diet, and that's why we suggest people to go into the Mediterranean. It's something you can stay with, obviously, the rest of your life because it's quite palatable and enjoyable. But patients do come to me, and I'm sure they come to you frequently and say, well, I tried to lose weight and I gained it back. I couldn't stay on the diet, but doesn't that help me just to lose weight even if I gain it back? Well, this has been looked at, and it's kind of surprising because there are people that weight cycle, and weight cycling increases mortality by about 45%. And weight cycling is defined as people that lose 5% of their weight and then gain it back. And that is not uncommon. Cyclers are about a third of this cohort, of a very large cohort. This is actually a meta-analysis of multiple studies, 600,000 patients. But you can see that cyclers make up about a third of patients, and then other people gain the weight, but they don't lose it. So this makes up over 80% of patients either gain and never lose or cycle. Only 5% of our population usually loses weight, and only about 8% are stable once they hit adulthood. But unfortunately, it does increase mortality. What I was going to finish up with just 2 slides on the DISCO study, which was out about 2 years ago. It was dietary interventions for coronary artery disease regression. And of interest that they gave people either statins alone or statins plus a Mediterranean low-salt diet, also called the DASH diet, and found that the people on the statins plus the DASH diet had about a 40% reduction in vulnerable plaque by CT scan, as compared to the ones on statins alone that did not have any reduction or very minimal reduction of vulnerable plaque. Remember, that's the plaque that can be reduced because it's lipid rich. Fibrotic or scarred plaque is not reduced. So the DISCO diet has pretty clearly shown that we can reduce coronary artery disease, lipid rich plaque with statins combined with obviously a good healthy Mediterranean type low salt diet. So the summary really is just to go over what we've talked about. First is that diet is a very big risk factor for what we have for our diseases that we have in our world now. Secondly, that we're eating a lot of ultra processed foods, which are obviously causing us significant problems. Less than 5% of adults eat a healthy diet. in our children even less. There's no one single healthy diet. It could be more fat. Mediterranean is actually a pretty high fat diet. It could be more carbs, like unprocessed carbs. As long as they're unprocessed, you'll do fine. The less ultra processed foods and sugar sweetened beverages and processed meat, the better. And then finally, don't forget, and I tell patients frequently, there is nothing you do to make your health better that's ever too little, and there's nothing you do to make it better is ever too late. So one bite at a time can be very helpful to you. And finally, know your why. Ask patients why they're eating and have them start to have some introspection. And many times we're eating and we don't even remember we eat. It's kind of just a habit, and we've got to get away from that. And I ask patients to actually approach their food as if they did when they had maybe a 6-month-old child. You were very careful what you put in your child's mouth, and try to do the same with yourself.